In the D.C. Examiner on Berwick, Donald Berwick, the new healthcare czar. He's the czar of the Centers for Medicare and Medicaid Services, CMS. And here's from Byron's story. During fiscal year 2003, the institute, where this guy worked at the time, created a post-retirement health benefit for its chief executive officer. It provides the CEO and his spouse medical insurance from retirement until death. The present value of the estimated cost of this benefit is approximately $120,000, which is being accrued over the CEO's estimated remaining service period. The amount expensed by the Institute for the years ended 2009 and 2008 related to this liability was approximately $12,000 and $17,000, respectively. The bottom line is that Berwick and his wife will be covered for the rest of their lives, a benefit that was on top of the $2.3 million in compensation the nonprofit gave him. He was working for a nonprofit, 2008, and he earned $636,000 a year in 2007. This is all from his deal with a nonprofit, Institute for Healthcare Improvement, a nonprofit healthcare charitable organization he created and which he served as CEO. So he gave himself lifetime and his wife lifetime health insurance from the time he retires until the time he dies. And he's huge. Oh, not just rationing. He's a huge rationing supporter. Which ultimately means death panels. Now here's Henninger. Daniel Henninger today in the Wall Street Journal. And as you listen to this, and you couple this with all the other news, today, yesterday, this week, last month, it will become obvious to you that Obama and his thugs really don't care. If they lose the House and the Senate, doesn't matter. The polling that shows the majority of the country hates all of this stuff, it doesn't matter to them. They are taking full control without the legislature, without a mandate. They are just waving their magic wand and doing all of this. Barack Obama's incredible recess appointment of Donald Berwick to head the Centers for Medicare and Medicaid Services is probably the most significant domestic policy personnel decision in a generation. It is important to the direction of the country, more important than Elena Kagan's nomination to the Supreme Court. Court decisions are subject to the tempering influence of 9 competing minds. Dr. Berwick would direct an agency that has a budget bigger than the Pentagon. Decisions by the CMS, the Centers for Medicare and Medicaid Services, shape American medicine. Dr. Berwick's ideas on the design and purpose of the U.S. system of medicine aren't merely about change, they would be revolutionary. Now, one may argue with these views or not, but for the president to tell the American people they have to simply accept this through a recess appointment is beyond outrageous. It isn't acceptable, nor is accepting the rules for free service that were announced yesterday. The Democrat chairman of the Senate Finance Committee, Max Baucus, was taken aback at the end around. He said Senate confirmation of presidential appointees is an essential process prescribed by the Constitution that serves as a check on executive power. Well, let's look then at what Obama will not let the American electorate hear Dr. Berwick say in front of a committee of Congress. These are excerpts from past speeches and articles by Dr. Donald Berwick. Quote, I cannot believe that the individual healthcare consumer can enforce through choice the proper configurations of a system as massive and complex as healthcare. That is for leaders to do. You don't have the brains to be in charge and make choices involving your own health. That's for leaders to do. Here's another one. You cap your healthcare budget. You make the political and economic choices you need to make to keep affordability within reach. Not you, but they will cap the budget. Please don't put your faith in market forces, he wrote. It's a popular idea that Adam Smith's invisible hand would do a better job of designing care than leaders with plans can. Indeed, The holy grail of universal coverage in the U.S. may remain out of reach unless, through rational collective action overriding some individual self-interest, we can reduce per capita costs. It may therefore be necessary to set a legislative target for the growth of spending at 1.5 percentage points below currently projected increases, and to grant the federal government the authority to reduce updates in Medicare fees if the target is exceeded. About 8% of gross domestic product is plenty for the best-known care. A progressive policy regime will control and rationalize financing. It'll control its supply, too. The unaided human mind and the acts of the individual cannot assure excellence. Healthcare is a system, and its performance is a systemic property. Healthcare is a common good, single payer speaking and buying for the common good. It's important also to make health a human right because the main health determinants are not health care, but sanitation, nutrition, housing, social justice, employment, and the like. Hence, those working in healthcare delivery may be faced with situations in which it seems that the best course is to manipulate the flawed system for the benefit of a specific patient or segment of the population, rather than to work to improve the delivery of care for all. Such manipulation produces more flaws, and the downward spiral continues. For-profit, entrepreneurial providers of medical imaging, renal dialysis, and outpatient surgery, for example, may find their business opportunities constrained. Meaning, if he gets his way. One over-demanded service is prevention. Annual physical, screening tests, other measures that supposedly help catch diseases early. There are many, these quotes go on and on and on, that illustrate the socialist collectivist nature, the bureaucratic command and control belief of this guy. One of them is young doctors and nurses should emerge from training understanding the values of standardization and the risks of too great an emphasis on individual autonomy. Now, there's no need to rehearse the analogies in literature and social thought that Berwick's ideas summon. That the Obama White House would try to push this past public scrutiny with a recess appointment says more about Obama than it does Berwick. Vilifying Berwick alone for his views is in a way beside the point. Within Obama's circle, they all think like this. Defeat Dr. Berwick, and they'll send up 50 more who would pursue the same goals. If the American people want the world that Dr. Berwick wishes to give them, that's their choice. But they must be given that choice with full televised confirmation hearings. Barack Obama, Donald Berwick, the rest may fancy themselves philosopher kings who know what we need without the need to inform or persuade us first. But that's not how it works here. And that is Senator Baucus's point. Although Baucus is not going to do anything other than caterwaul about it. He's not going to stop anything. Henniger says it should be clear why Donald Berwick's bigger than Kagan. We need a large public debate over these views, over what Obama has said his health plan would and would not do. We need to find out if every Democrat in Congress and every Democrat writing newspaper columns and blogs agrees with Dr. Berwick about clinical and individual autonomy and about leaders with plans. And then we need to build an election around whether we want to go down the road Dr. Berwick has planned for us or start dismantling this one that President Obama paved through Congress on a partisan vote. Henninger, I've never seen him so worked up. This is more important than Elena Kagan. I have never seen him. I've never read him this worked up about anything.